Good morning, everyone. Thank you for this opportunity. Today, I am excited to introduce Uveoscope, a mobile application designed by uveitis specialists to assist doctors in diagnosing uveitis and recommending appropriate ancillary investigations and blood investigations. Let's start with a small story of a 35-year-old Mr. Kumar.
Good morning. What brings you here?
I am having eye pain and redness since few days.
Looks like you have uveitis. You will need some blood investigations.
Doctor, all my blood tests are normal.
Looks like you will need more tests.
My vision is more blurry now.
Don't worry. We will do more tests to find out what your actual problem is.
I am going blind. All my test reports are normal.
So
Good
this
morning.
is a story.
What brings you here?
So this is a story I see often in my clinic. It inspired me to create a Uveoscope. We all know Kumar's story is not a unique story. Uveitis is a leading cause of preventable blindness. Diagnosis is complex with 30 plus causes requiring multidisciplinary approach. Doctors face delays and treatment is delayed. So introducing Uveoscope is a mobile application designed to bridge this gap by helping doctors to make informed decisions, ensuring a precise and efficient diagnostic pathway. So now let's see how this works. This is a working model we created. It's freely available in the App Store. First, we will enter the demographic details of the patient. This is one random patient. And enter the symptoms, which includes only the uveitic symptoms. Next, we can include the past history if it is available and required past histories, and we get a summary of the history. And next we go into the examination, in which we will enter the vision, IOP and anterior segment examination, whichever is positive. Focusing only on the uveitic examination findings. Posterior segment also similarly. So this will give a final summary of history and examination with a probable diagnosis with recommended ancillary test and a routine blood investigation which is needed. So why should we use this Uveoscope? The key features are, it is expert driven algorithm developed by a uveitis specialist. It is user-friendly interface, is easy and simple navigation. Comprehensive investigation guide which recommends relevant blood investigations and imaging. Evidence-based approach ensures clinical accuracy and reliability. Next is time saving, helps doctors to streamline the diagnostic process. So who can be benefited by this? General ophthalmologists who don't have an access to the uveitis specialist, and residents and fellows, and physicians and rheumatologists who wants to get to know more about the uveitis in detail. So what is the advantage over the traditional method? Traditional method requires extensive experiences and access to multiple guidelines, and this Uveoscope is instant evidence-based recommendation at the point of care. So future development is, I would like to do it with the EMR integration and multilingual support for global accessibility. Uveoscope is more than an app, it is a powerful tool designed to empower us to fight against uveitis. So, thank you.
Thank you. Any questions, sir?
I appreciate you are saying that it is more than an app, but I am still not convinced with it, because I thought that it was a methodical way of just entering your data and coming out a little bit of software going into to give you a probable diagnosis, but not more than that. However, I appreciate.
So thing is that what happens is we give more investigations and patient face delays, and patient is coming with the occlusio pupilla and occlusio
Left to
pupilla.
myself, I would have marketed it like that there are so many things, and this makes it easier to pinpoint from amongst this.
Just one thing, it was a nice, what you say, effort, but you said it was an algorithm driven.
We feed the data.
No, when you are feeding the data, it's all right. But if you are creating tests, suggested investigations, that is based on an algorithm. You said it was written in your slide.
Yeah, it is like.
So who created this algorithm? Is it AI or
no,
you?
we create.
So how did you create that algorithm?
Like we have this acute anterior uveitis have this all this common features, and if it is for acute anterior uveitis, we don't do any recommended ancillary test. So, but in so many places, first of all, when we see uveitis, we will go for OCT, macula, FFA. We'll have to see whether it's needed or not. All this
Okay.
can be recommended.
I
It is
just
not.
want to congratulate you because it's going to give a basic workup for any uveitis patient.
That's
So that's very well appreciated.
Thank you so much, ma'am.